Going in depth for you about that issue. It comes up every 4 to 8 years with the president's term. Different parties taking different sides depending on who won, complaining about executive orders at the White House. President Joe Biden has signed about 30 in his first week, expected to sign more today, as we just mentioned. So we wanted to know, how does that stack up historically when it comes to other orders signed? According to the American Presidency Project, former President Donald Trump came out on top. He had the highest average at 55 per year. 220 total in his 4 years in the White House. Former President George W. Bush is in the middle with 291 during his 2 terms. And former President Barack Obama had the smallest average of orders, around 35 a year, 276 total in his 2 terms in Washington. Now get this, the most recent president in the top 10 list of executive orders is Ronald Reagan at number 10. At the top, FDR. During his 12 years in office, he signed 3,721 orders, an average of more than 300 a year, 307.
We want to go more in depth this morning on that topic, vaccines. We've told you the importance of getting your shot, but what kind of side effects should you expect from getting it? The CDC says some common side effects are pain and swelling in your arm where you got the shot, kind of like the flu shot, right? Other side effects can include having a fever, chills, being tired, or having a headache. If you start feeling some of these side effects, should you be concerned? Well, here's what the new head of the CDC had to say.
These are all normal and expected part of getting the vaccine, especially the second dose. And these symptoms mean that your immune system is revving up and the vaccine is actually working.
So while these symptoms are normal, the CDC says if you have pain or discomfort, you can talk to your doctor about taking an over-the-counter medicine like ibuprofen or acetaminophen. But when should you call your doctor? Well, here's the deal. If the redness or tenderness where you got the shot increases after 24 hours, call the doc. Or if your side effects don't go away after a few days.
Now to a fact check all new this morning. We've told you people who've had COVID should still get the vaccine. But with the ongoing shortage of doses, should you wait longer to get a shot? Both the World Health Organization and the CDC say people who have been infected and recover could delay getting their vaccine because they have some immunity from the virus. This would allow others who have no protection to get vaccinated first. The CDC says you shouldn't be vaccinated until 90 days after your infection. But the WHO says you can wait up to 6 months and still have some protection.
It's new this morning, a fact check, and it has to do with something we've all been doing for months, wearing a mask.
Should you wear 2 of them? There are some new changes to guidance suggesting upgrade your mask, maybe even double up. With the more contagious strains of COVID spreading around the world, some recommendations now say you should wear at least 2 masks to help protect you from those easier to catch versions of COVID. Here's what we found experts are saying on whether that actually works.
You know, it likely does because, I mean, this is a physical covering to prevent droplets and virus to get in. So if you have a physical covering with 1 layer, you put another layer on, it just makes common sense that it likely would be more effective.
Wearing 2 masks helps improve the filtration ability of the mask in both directions. And so it helps protect you better and it helps protect others.
All right, while N95 masks are still the gold standard, blocking 95% of air particles, they're harder to find and they should be safe for healthcare workers. Researchers at Virginia Tech also found layering up with 2 cloth masks can get your number of protection from 50 to 75%. And wearing 3 layers of a mask can block up to 90% of particles. Again, that is just about N95 protection.